Welcome,
Exactly.
Dr. Young. We're glad to have you. Thank you, Shane, for organizing your team to come on and speak with us today.
Yeah, thanks
Really,
so much for having us.
really. Okay. How about now? You still getting that echo?
I think we're good. I was getting like a playback, so
Yeah.
it would be you said 15 seconds ago, just played back extremely clearly. Very strange.
Yeah, we adopted. We're like early adopters to this Hop-In platform, and there's still a lot of bugs. But we fight through them just like how you had to get here backstage. You went in, then you had to repaste the link in the browser. It's one of
Exactly.
those things. It's like life, right? It's never going to be what you think it is. You got to find a hack. But the Hop-In platform, look, we paying for it. We're not paying to fix your bugs. So I've been trying to talk to them on Twitter, like, yo, come fix this. But we'll see what happens. But it didn't stop you all from getting here today. And it hasn't stopped our guests that have been with us for the last 13 days here in this Global Tech Slam. Really appreciate you all. Want to give a shout out to our sponsors, EA Sports, Electronic Arts, one of our sponsors, Aon, another one of our sponsors. Blue Shield just came on today as one of our sponsors, and the Golden State Warriors and Google Cloud Basketball Decoded. So really appreciative of those folks for thinking that we actually were doing something right. So much so they wrote a check. And then again, I want to thank you all for being here today. Shane, again, you're great. You're amazing. Thanks for reaching out a few months ago. Shane's just reached out. She's like, hey, how can we get down? And I'm like, well, I got this thing called Global Tech Slam that might be of interest to Carbon, particularly around Carbon's mission and what you all stand for. And in that time frame, I actually found out that I have a very, very, very close friend that is also a part of the Carbon family. Her name is Alicia Zakon. We went to high school together.
Nice.
Yeah.
We went to junior high school and high school together. And she's like, I'm at Carbon. I'm like, what? I'm talking to Carbon on the phone in a few days. And so it just small world, everything's coming together. Really like what you all stand for as an organization. But yeah, let's get into it. So if you want to share, there is a right next to the mute button, you'll see a screen with the slash through it. You hit that and it'll ask you what you want to share, and you just kind of follow the prompts from there.
Okay.
And then I'm going to back out the way. But thank you, everybody, for tuning in. This is Social Impact Wednesday. We've got Carbon Health on with you today, who will come as they are and share some information with us about themselves and the company. Thank you.
Thank you.
All right. I guess the floor is ours, Io. You ready for this?
Born ready. Let's go.
All right, absolutely. I'll go ahead and share what we've got. If you want, you can start up. I'll just share our screen from here. Does that work?
Sure. Yeah, sure. Yeah. Do you want to maybe just pull it up first?
Yeah. Let me grab it real quick.
Yeah.
And hold on 1 second. Here we go. How does that look?
Oh, brilliant.
Perfect.
Brilliant. Sweet. So do you want to introduce yourself first, or should I?
I'll let you go first. Go for it. Why not?
All right, so I'll try and keep this short. And I think this type of thing is best if I think is everybody else on the call able to leave messages? Do we know that? Akeem, do we know?
It looks like there's
basically I think it should be
the
possible.
Main screen. Yeah, I think in the main screen under event we
that
there. So for everyone tuning in, welcome and good morning. If you have any questions, see, there they go. They're already responding. So Yeah, if you have any questions, feel free. We want to make this as interactive as possible.
Yep.
You know, as interactive as it can be through a screen. Wish, you know, we were able to be there in person, but in the middle of a pandemic, this is kind of the best we got. So
Yeah.
we'll make it work. If you have any questions, feel free to send them to us in the chat. And yeah, we're Carbon
We'll try and
Health.
answer them.
Yep, and we'll go from there. So
Yep.
hopefully you can see our screen right here. This is one of our mobile COVID testing clinics that we have around Northern California. And again, as you already know, my name is Dr. Justin Young. I'm one of the clinician managers and doctors here at Carbon Health. And Io, go for it. Tell us about yourself.
Oh, sweet. So my name's Io Modula. I am the head of product at Carbon. Roughly speaking, what that means is I help make sure that we have a good experience for our patients, experience for our providers, other entities who interact with us, primarily through software. I help us figure out if we're solving the right problems, and you know, overall, you know, the thing that I'm responsible for is experiences, online and off. I've been at Carbon about 6 months, and I've been in that time is the length of time that I've been in healthcare. I've been, you know, in healthcare and at Carbon for about 6 months. In a previous life, I worked on an app called the Cash App, which I'm hoping a few of you, you know, here in America will know. And I built Cash App's, you know, banking product and functionality. I spent 6 years doing that, and then I spent the you know, time before that mostly building failed companies. So I, you know, failed like 7 or 8 times in a row before I had a hit record, and the record was not that good, trust me. And yeah, really happy to be here. Wanna share my story, Carbon story, answer any questions anybody has over the course of the next 45 minutes. Justin, do you wanna take it?
Sure, happy to do so. So Io, I guess I've been with Carbon a little bit longer than Io has. I'm coming up on a year, I think, with the company, and I've been a doctor for going on almost a decade now. But yeah, just kind of been working here in Los Angeles. The company itself is based mostly out of Northern California, with a few clinics up there, and we just most recently, kind of expanded down into Southern California as well. So we have a clinic just outside of San Diego in Carlsbad. And then also we have a clinic here in Echo Park, which is where I am right now, hanging out for a little bit for the day. And then also a clinic in Pasadena. But I grew up on the East Coast, in New Jersey and Atlanta, and then basically made my way out to Los Angeles probably about 6, almost 7 years ago. So it's been kind of an incredible experience. And I've been doing kind of primary care and urgent care for the duration of, you know, my being a doctor, and wanted a change of scenery. So Los Angeles was kind of a nice fit from Atlanta. So here I am now. I've been working with Carbon and really excited about what Carbon can do. Which, speaking of, I guess we should give you a little bit more context about, you know, what Carbon is about. So basically, Carbon itself, the easiest way to describe it, I mean, how would you describe it from your side? I know how I would describe it from the healthcare side,
Yeah.
you know, being a doctor, but I think a lot of times when we're talking about like products and we're talking about apps and we're talking about, you know, with the experience that you've had with the different startups and different products that you've worked with, how would you try to crystallize who we are?
Yeah. Well, maybe you go first, and I'll try and meet you in the middle.
Okay, sounds good. We can definitely do that since we're blending health and tech. To me, the way I describe, you know, Carbon to a lot of patients and a lot of people that ask me about it, Carbon is a doctor in your pocket, basically. We're a series of healthcare clinics, and one of the great things about what brings the doctor to the patient through Carbon is the fact that we have this incredible app. So the app is on your phone. It's like having a doctor on your phone, and that app to us. So you can set up appointments easily and be seen in clinic in one of our locations around Northern California. in San Francisco, Berkeley, Oakland, as well as down here in Los Angeles. But beyond that, we also offer virtual care, which basically means you can have a video visit right in the palm of your hand. So if you have a phone, smartphone, that way you can kind of connect with us and have a visit, as well. So what we're doing is meeting the patients, where they are. And as a lot of you, through Hidden Genius, you've been able to kind of work on and build up your own ideas and your own concepts and your own programs and platforms. This is one of those ways that we saw a need to reach out to patients all across, really anywhere at this point, but all across California and even beyond. And we're trying to expand our virtual care into, the rest of the United States. And we serve, I think, at least 2/3 of the American population at this point. Sorry if I was long-winded. Did I give you enough to meet me halfway? I think.
Yeah, no, that's
came all the way to you.
That's more than enough. The only difference, the only thing I'd say that's slightly different from the way you described it is, today Carbon is a doctor in your pocket. The ambition is to be the doctor where you are, and so, there's a lot of things in healthcare, and more over time that can be handled remotely, and so having a doctor on your phone is a benefit. But the ambition by far is to be, hopefully this doesn't sound too crude, but the clinical equivalent of McDonald's, where like anywhere you are, there's probably McDonald's close by. Anywhere you are, we want Carbon to be within arm's reach. And that means in your pocket, in person, kind of how we want to meet you where is most convenient for you. And we think if we do that, it will end up being a more accessible, basically more people will feel good using it, and will have a better experience doing so.
Yeah. I mean, I think that's definitely the approach and the goal. And I think that's what I think what's so exciting about Carbon to me is that that's the way that we change the landscape of healthcare in this country, and so that's part of that vision itself to expand and be available and accessible, I think is amazing. And part of the reasons why I'm, really passionate about what we do and trying to find ways to improve on that and expand on that. And certainly during this pandemic, we have demonstrated that for sure.
Yeah, I would agree. You want to keep going on slide?
Yeah.
So maybe Justin, you want to give some insight into what we've done around COVID, and I'll supplement anything you missed.
Yeah, absolutely. So basically moving through, looking at the slides here, what you're seeing is basically the perspective of all of what we just talked about. Our in-person clinics, some of the testing sites and the partnerships that we have. We've been working with the city of Los Angeles to help with testing for COVID-19 down here. And then also in San Francisco, we have a variety of different locations through our mobile testing clinics. We've been going to nursing homes and skilled nursing facilities to work with some of the vulnerable populations there. Again, the app allows us to have that flexibility to basically load up a cart or load up a wagon and go in and be set up to test, a bunch of patients in a number of different locations, different areas, to again help during this pandemic. So it's one of those ways that we have been able to give back, and that gives us the flexibility to do so when you have the app at your fingertips, an iPad, an iPhone, all of that, to be able to grant access to some of the areas hit hardest by this pandemic. So we've been able to do that. Basically, as we said, what is Carbon Health? As you can see, this is us in our Pasadena location. It's a technology-enabled healthcare provider that combines technology with modern clinics. So all of what Io said and what I mentioned earlier, that's how we connect and reach out to our patients. And this is an incredible way, an incredible platform for us to expand and grow, to be able to connect with all of the services, in addition to virtual care that lets us connect to patients in their home or wherever they may be. Our mission is to provide world-class healthcare, make it accessible to all. And so through the technology, we're able to do that. As we said, we've been fighting COVID-19. We've been working with a bunch of different businesses as well to try to figure out ways to bring their businesses back to the forefront, so people can come back to work safely. A variety of different companies, organizations, even some productions that we've been working with to try to connect and be able to get people back to work and people back to work safely, especially. As I mentioned earlier, our mobile clinics have been reaching out to different communities, particularly those that have been adversely impacted by COVID-19. I know a lot of places, we've been seeing the numbers rise really, over the last few weeks, especially, in very, scary ways. But as a company, it's been exciting for us because we have been out and involved throughout the whole time. Hold on 1 second. Let's see here. So basically, this was a time for us to be able to, connect and be able to really kind of demonstrate what we have been able to do and how we've been able to reach out to our patients and reach out to the community. We've done really a ton, and this has been really exciting. It looks like we actually have a question that just popped up. Isn't this healthcare expensive? Actually, in a lot of ways, because of the technology that we use, we have actually been able to reduce cost. So a lot of our virtual care offerings, we've been serving patients who have insurance or even patients who don't have insurance. So there are, affordable alternatives and affordable options that are available. So I think the broader problem, to answer that question specifically, the broader problem is, as a country, healthcare is incredibly expensive. And so one of the goals of what we're trying to do is bring that cost down by granting that access and granting that availability through our app. So specifically, is Carbon itself expensive? No, not any more expensive than some of the other companies that you see out there. But our goal is actually to make sure that we are maintaining and providing affordable, accessible care for our patients, and that's affordable care for virtual care visits, for primary care visits, for urgent care visits, even for mental health visits and needs. We do provide affordable options that are definitely much more affordable and accessible than a lot of companies that are out there.
Yeah, I would only add to that and say we do have an explicit goal to make healthcare more affordable. So before I joined Carbon in February, before I joined, I had my first conversation with Aaron, who's our founder. He made this comment where he said, I never lose sleep at night thinking of how to make rich people more healthy. Which is, I think, just speaks to our values. So, Jordan, to your question, healthcare is expensive. We're trying to make it cheaper. Yeah. We're open to other questions. I think so. A couple of things I'd add on what Justin mentioned. When the pandemic hit around February, we had, I think we had the first COVID case in California in one of our clinics in January, even before the test was available. Mm-hmm. And in February, we made a decision that we would do whatever we could to help. And that meant, and I think this is when we were thinking about what we could do, the reality is, on the spectrum, we're pretty small. Carbon mm-hmm. has we have something like 16 locations if you look across our entire network.
Yep.
And they're all in California and Nevada. And so there's just a physical boundary on how many people we can touch in person. And so we asked, what could we do to improve people's experience around COVID and improve the likelihood that people, diagnose themselves, et cetera. And so we did a few things. Justin called out that we decided to do testing in our clinics, and this was a hard thing to do. Our teams were putting themselves at risk by being out there, and we had to do whatever we could to protect them. Mm-hmm. And then we also decided that we were going to create tools and to create tools to improve people's ability to respond. So, some of the things that we did, Shane and Matsui, who are in the audience, drove a bunch of this, was building out, we have very senior clinical directors who spend a lot of time reading the scientific literature, understanding how transmission works, how to operate safely, and so on. And the team started building out like a pretty massive content library to make it possible for anybody on the internet to like find out more about COVID and like get it from a reputable source. So we did a bunch of things like that, and talking about things from as narrow as how to wash your hands and how to wear a mask to as like broad and high level as here's what antibodies might mean in terms of if you have antibodies, you're not necessarily immune. Here's like the state of the science.
Yeah.
And so that was sort of one body of activities, and then there was another body of activities which were tools that we created to make it easy for people to, for example, we created a tool that made it easy for people to find where to get a test near them. And so we literally had a group of people call every hospital and clinic in America and ask if they were testing, their hours of operation, et cetera. And then we took all that information. Like, I think there were maybe something like 17 or 18,000, places that we called. We call them now, every few weeks, and get that information from them and, make it available. And so to Justin's earlier point about we're a technology enabled primary care and urgent care provider, the very narrow idea is like, yeah, we're providing primary care and urgent care, and you can like call our doctors and talk to them, or you can walk into our clinics and get a test. But the big idea is, healthcare is expensive and can be like incredibly confusing. And we are trying to make it cheaper and clearer.
Yeah. And I mean, honestly, to your point, Io, I think it's really interesting to kind of look at that timeline across the spectrum of the whole pandemic. We had COVID, we're like, 5 months into this now? And so as a company, I think what was really exciting for us, we're on the front line and we're dealing with this pandemic that's new to everyone. Nobody knows, how this all like plays out and what, where, especially when it first started in February and March. And so I really have to give you and the rest of the, engineering and development team, credit, because when COVID hit, what was the first recommendation? People needed to stay home. They needed to isolate. They needed, stay at home orders were in place. So how do you get that access? How do you get care to patients? And so those resources that our teams were able to provide through the tech, and I know you don't like using the word like tech as it's like this nebulous like ghost that exists, like it's magic or something. But the reality is the technology that we're able to use through our app allowed us to still provide that care. We kept our doors open from the start and still open now, where other, bigger health organizations, had to retreat a little bit. We were, figuring out ways for us to be able to connect with our patients. And so the tech allows us to do that. The technology that we have, the resources that we have allowed for that. So we were having virtual care visits and seeing patients by video, which really expanded. We were seeing patients all across the country to help them through the first stages of the pandemic. And then as tests became more available, patients were coming back into clinic and we were starting to see more and more patients and providing that access as well, so that we were able to, create these partnerships to test all these patients. And as that kind of progressed, as a company, we were able to be nimble enough and flexible enough to provide other resources and ways to manage this. So, the team also just developed a symptom tracker that basically, as a part of the app, was asking patients what their symptoms were each day, so that they could objectively try to track and get a grasp and a handle of what their symptoms were in these uncertain times with the pandemic. So helping people understand, how COVID impacts them has been really, really exciting.
Justin, can you, just switching gears for a second, do you want to maybe talk through, like, tell us your story, like how you decided to go into healthcare and become a doctor, and what was that like?
Exactly. For me, honestly, I don't know. That's a good question. I've always been somebody that wanted to, help others and give back. I've always been interested in the sciences. Like I mentioned earlier, I grew up, in New Jersey and Atlanta. I grew up on the East Coast. It was kind of this natural progression for me to become a doctor. Like I've always been interested in science, always interested in medicine, and it was the kind of thing that I wanted to do. I think specifically as a Black man, you know, myself, like being a Black doctor, my experience is framed through that lens, you know. And so what does that mean for me? Growing up, I was fortunate enough to have a family and have a supportive community, really, beyond just my parents. My parents were always able to provide us with positive examples of, you know, specifically like Black success in community. And I think that reinforced and always instilled on me that there were no limitations to what I wanted to do, and where I wanted to go and who I wanted to be, or if there was anything that I wanted to experience, there were ways that I could, you know, reach out and look into finding ways to do that. So for me, you know, growing up, that was what was common and familiar to me. And I know that's not necessarily what's available to everyone, but I think in this day and age, you know, there's a lot of information, there's a lot of exposure that's out there, and ways to kind of build your own sense of community for what it is that you want. So that's been kind of the main focus and the main drive for me, for that support. So, you know, from there, high school in Atlanta, you know, kind of a nerdy, geeky kid, played sports, but also, I don't know, I guess pretty smart. And beyond that, went to college in North Carolina, went to UNC Chapel Hill, which was an incredible experience there as well. And then went to a historically Black medical school, Meharry Medical College, and still to this day trains the most African American and, you know, Black doctors here in the States. And so I've had a range of experiences and really had an exciting time kind of progressing through that. But to answer your question, that's kind of like where it was for me. You know,
Yeah.
it just made sense. What about you? How did you make your way into tech?
Oh, I, you know, it was kind of roundabout. I was like making stuff when I was young. I used to draw comics and try and sell them.
Mm-hmm.
Nobody ever bought them. So I grew up mostly in Nigeria, and I like the biggest sort of, you know, source of fun for me and I come from a big family. I have 5 siblings. We used to play video games all like together, and then we used to do really weird stuff like try and take the video games apart and put them back together, or
Mm-hmm.
take you know, the game controls from like the NES and you know, make that controller work with the Super Nintendo.
Yep.
And so the consequence of that is I thought I was going to be an engineer, and when I applied to engineering school, I got bounced out. So I did economics instead.
Okay.
And then 2 of my brothers ended up being engineers. And the way I actually got into tech was like in 2007, Twilio launched. And my brother was like, oh, let's go build. Like he was like, let's go build something that, you know, when you call a corporate line and they're like, hey, if you want to do X, press 1.
Mm-hmm.
I was like 25, and he was like, oh, like let's build that thing, and we can like make it cheaper than, you know, Oracle or whatever.
Yeah.
And then we tried to build that, and it was like a massive failure. And we like spent years banging our head up against the wall, and I went into a lot of debt,
Mm-hmm.
which I wouldn't recommend, for the record,
Right.
to anyone. And that's how I got into tech. And then I, you know, my brother and I, still really a family affair, just spent like the next 13 years just building stuff together, and building, you know, we have like so many weird apps that we've built together. And along the way, we built a company that we ended up selling, and that led me to Square, where I worked on Cash App, and then that led me to ultimately to healthcare after I met Aaron last year,
Yeah.
Yeah. And I kind of, you know, both my parents are doctors, and I have the like truest gift that I've been given is the gift of having a doctor who loves you,
Yeah.
and understanding the difference between the quality of advice you can get from that person.
Mm.
And so you know, I learned it honestly probably in the wrong way. I grew up with doctors, and they were very like incredibly attentive to us, and so
Mm.
I kind of assumed that that's what all doctors were. Um,
Nope.
and and so I had this like crazy trust, like you wouldn't believe. I had this crazy trust for doctors, and I had my brother had an event where he was hospitalized in 2010,
Mm.
and uh, so we're like sitting in the hospital with him, and the doctor comes in. He's an interventional radiologist. My
Mm.
dad also is a very highly trained, like well respected radiologist. And my dad's not there, and so this guy comes in and he's like, "Yo, we found the problem. We're gonna do surgery on you. We're gonna pull." It was a blood clot. And he was like, "We're gonna pull this clot out."
Mm.
um, and the clot's only in your right leg. And we're like, great, he's gonna get this thing, gonna be out of the hospital, all good. And my dad calls, and he's like, and my dad, I'm at this point I'm like 27, and for anybody who's 27, like you think you know everything and that you're
Mm.
invincible. And so my dad calls, and he's like, let me talk to the doctor. And I'm like, no, you shouldn't. Like, you're just gonna fuck things up. um, and and the guy came in, and I called my dad, and like gets on the phone, and like it turned out that my dad had trained the guy who trained him, and like asked
Oh,
him
wow.
to run a couple of
Yeah.
extra tests. And the net of it was, if they had gone ahead with the surgery, my brother would have died.
Mm.
And it kind of just got me thinking. It was one of the things that got me thinking, huh, I've really assumed a thing is true that really is not true,
Yeah.
which is that, the way, like, I've assumed that the way the healthcare system is set up by default is that it's defaulted to take care of you.
Yeah.
And in America, that's really not true.
Yeah.
And there have been other examples over the years. I think it's more, um, it is a little bit like an assembly line. There's like actions that people can do based on input,
Yeah.
and on average, those actions should lead to a better outcome for that patient.
Right.
But like, God help you if you're not the average. And I think what, sort of my ambition at Carbon, and I think this is Carbon's ambition is in general is, can we have like a really high quality average outcome
Yeah.
at a really low cost? And I'm very excited to do that. But I think it's just like, the roundabout way. Like, I came the roundabout way through
Yeah.
like building stuff, and then like have had a decade of like dealing with some kind of health problem all the time.
Yeah.
And now I'm like, okay,
And
those two
brought you to
things now
health.
have to be the same. Yep.
Yeah. Well, I mean, I think you bring up some awesome points there, though, is that, like, medicine it can be so massive, and it's not
Yeah.
perfect, and it's not infallible, right? Like, there are mistakes that are made all the time, but in order to like
And people are really trained to think that it is.
right, exactly.
Yeah.
And I think, one of the beautiful things about what we're trying to establish with Carbon is that if you increase that access, and if you grant the ability to all of the providers and the teams that are involved, if you grant them the access to the information that is there, then there is more clarity, and you provide better care for the patient, and that's the main goal. I think the other thing that I often hear from a lot of different people, as you kind of progress through life, it's not some linear path. It's not a straight line, right? Shortfalls, their pitfalls, and accidents that happen, right? And so, I think there are lessons to be learned in everything. I was a surgeon, and I'm definitely not a surgeon right now, right? And I, went to med school and, kind of made my way through life and thinking that that's where I would end up. But, you never know what's going to happen. I mean, I was on a reality TV show running around the world with my sister, at one
Wait,
point.
what?
So yeah, my sister and I were on the Amazing Race.
Dude,
And
wow.
I never thought that would have happened. So we're running around in, Taiwan and Indonesia, all of that. And so I think it's important to know that every step of the way, there are lessons to be learned, and some ideas work out, some ideas don't. But there are lessons to be learned, from each of those things, and keeping the momentum going, keeping the progress going, and not giving up when things don't necessarily seem like they work out quite the way you expected. There are definitely some pleasant surprises that are there that lead you to something great, like a healthcare startup, healthcare tech startup company. I don't know if there are any other questions or anything like that out there. Akeem, do you have any questions for us specifically?
You are muted.
Yeah, I think you're mute. Oh, there he goes.
Here we go. And sure we don't have any questions in the poll chat. Let me read you the poll results.
Okay.
So 63% of our viewers say no, they have not considered being a doctor or a healthcare practitioner. However, 38% say yes. So there is some hope, right?
I mean, it's not for everyone, but the opportunities are definitely still there.
Absolutely. Okay, here's the next one. 71% said yes, they have considered working in health technology. So that's really cool. Out of our viewers,
we need all the help we can get.
Exactly. Right. There you go. You can help Io with that.
I got some help for you. I'm gonna give you some help in a second. Do you? Let's see. 89% of our viewers say they believe that healthcare is a civil right, and I think the right to live too, and have a practitioner or somebody that's not going to kill you. I know, to your point in your story with your brother. Let's see. 56% of them say they have struggled to navigate the medical system in their community. So I think that's right on par with Carbon's mission and trying to solve for that, making healthcare accessible and easier. So I just wanted to share those results, and folks are tuned in, folks are listening. But I did have a sort of questions, or maybe just ask for you both to kind of expand on. What do you think, or how important is it for our physicians and healthcare providers to be a part of the communities or share common themes in the community, or even look like us and have some of the same experiences as us? What are your thoughts around that?
Justin, why don't you start?
It's like I'll take it from there. Honestly, I think it's incredibly important, incredibly vital. I've worked in a number of different communities where I look like the majority of my patients, and communities not. And I think the experience that I get, for me, there's always the question of what does that mean to your patient, and what does that mean to the community you serve. And I think it's a lot. I think there's a lot of issues with trust when it comes to the healthcare, community at this point. Especially during a pandemic, people are trying to find answers and figure things out. And so for me, it is incredibly vital. And I've said this before, when I walk into a room, I know what the reaction is like, walking in and seeing a Black patient or any other patient of color, the excitement that they have for seeing, a doctor like me, but then also the sense of pride that comes with that is incredible. And I'm reminded of it every single time it happens. And when you see a little kid light up and, they kind of look with this sense of surprise and excitement that you're a Black doctor. and for patients particularly that are scared, and to know that when they see me come into the room, it provides them with an added sense of security, an added sense of reassurance, and it just eases more of their struggle. It eases more of their pain. You can't put a price on that. You can't like, it's absolutely invaluable. So it's obvious, it's still present to this day. So I hope the percentage, as that poll said, there were only 38% that wanted to pursue a career in healthcare. Like, we're needed, and this is important. And so, yeah, there are things that are missed. There are interpretations of how we experience healthcare in general. There are studies that show that white practitioners assume that Black patients perceive pain differently, and that, all the problems that are associated with those discrepancies. So that's a big issue. And the degree of care that we get is different because of that. And so Serena Williams, for instance, had to fight really hard to let her, OB team know when she was pregnant that she was, experiencing a blood clot. If Serena Williams, like the greatest athlete in the world, has trouble getting her needs heard as a in the healthcare setting, what are we supposed to do? You know what I mean? So we have a problem, obviously, and we need to overcome that. And so if it means having someone like me there to be a part of that, then I'm all for it.
I have nothing to add.
Mic drop, or earpod drop, whatever.
Yeah, exactly.
Look, it's been great having you all here. Thank you again, Shane, for organizing this for us. Io, Justin, y'all are solid. Y'all make me feel good. I'm that dude that when we're at the hospital and we see the Black practitioner, I'm like, yeah. Are you coming to see me? Like, are you coming to see me? Like, just let me.
Exactly. Like, oh, you're my doctor?
Yeah.
Okay.
Like, let me take your hand. But I also find myself with, bias. I'm staring at the name tag to see if I can see MD on it, right? Or RN, or just NP, just something that kind of shows. And it's not just the gentleman that may be tearing down rooms after the last patient left, right? So it's a point of pride, but I really appreciate, you all just doing what you do and just standing for what you stand for. Question now, how does one who has just finished up a medical assisting program get access to Carbon for an internship? There's a 120-hour requirement for an internship. Really likes the Carbon mission. Matter of fact, she's watching right now, just cheesing and smiling like, look at those Black men. But my fiance, she's trying to take that step into the space, and she's finished her program and wanting to get access to an internship and love Carbon. So I wanted to know what we might be able to do to sort of walk down that path and, sort of be a part of the Carbon team in that way.
Yeah. I have to check to see specifically like what mechanisms would be in place for that type of training and shadowing and that sort of thing. We definitely have opportunities and are expanding for MAs once they've completed their training as well. You have my contact information. So if she wants to reach out, we have a network of, clinicians, physicians, all types of, PAs, NPs, everybody who can reach out and at least find, somewhere to get her the help that she needs. So, and then also if she wanted to come, visit and see one of the clinics, we can see what we can do to make that happen. But yeah, if you want to connect with us offline, we can definitely make something happen and figure out what we can do to get something set up.
That's what's up. Appreciate you all. That's what the network is about, right? It's
right.
So the other day I had an engagement with Cash App. I got a problem. No, I'm joking. That ain't got nothing to do with you no more, right? The folks from Twitter, there's somebody on Twitter was posting, hey, if you send your bank statements and your Cash App name, we'll put money in your account. I'm like, what? So, I'm silly. Let me try it with my fake account to see if it's really real. And they turned out some hackers had got into it. And I'm like, okay. And then when you mentioned Cash App, basically you triggered my emotions. But I know right now you're on the other side of it, so I can't hold you accountable for that. But no, I really appreciate you folks for hanging out.
Oh my gosh. Well, thank you for having us. And honestly, the work that you all do is really inspiring and exciting. And keep doing what you're doing.
And we'll keep you all posted. We've got a site we just launched in Los Angeles. It'd be cool to have our folks engage at some point when we can get back out. And we've got a ton of young folks up here in the Bay Area. So this is just when Shane reached out, I'm like, hey, Shane, here's the quickest way we can get involved with each other and we begin our relationship. We're also very, very, protective of our young folks and their young minds. In their young minds, we don't want nobody coming in and telling them something that's not actually true or something that will get them all hyped up to let them down. So we're protected. So this is how we build relationships organically with companies and organizations and people. And so I keep saying thank you. I'm going to say it again. We will connect in some capacity in the future. I will forget about the Cash App. I'll let that go. As long as they cashed you out to do it, I'm all right.
Right, exactly. As long as you got your cash.
Right. But look, it's been great to have you all today. This is Justin Young and Io from Carbon Health, one of the hottest and emerging healthcare providers, the doctor in your pocket, and then eventually the doctor where you are. We really appreciate that. And that's really what we're trying to teach our young folks. The tech is where you're at. So I like the way you all said, the doctor where you are. We say the tech is where you're at. But no matter where you are in the world, you can have an impact on somebody's life. And that's the message that we're trying to preach and share. And with technology, technology just expands your passion. It expands what you love to do. And it makes it more accessible to somebody else who may be having the same issue. But again, we appreciate you all. We've got a few more speakers coming up. But in the meantime, we've got DJ D Sharp on the ones and twos. Thank you, Carbon family. Thank you, Shane, Justin, Ayo, Alicia.
Thank you for having us.
Thanks for having us.